I'm Melissa Markham, and I chose my nurse leader presentation on Florence Guinness Blake. I chose her from Google.com and looked up the top 25 nurse leaders and saw that she is an advocate for patient teaching for pediatrics. She developed teaching not only including just the child, but also including the family too and the caregivers. Florence Guinness Blake was born in Stevens Point, Wisconsin on November 30th, 1907. Her parents are Thelma Dunlap Blake, and she was a musician, and then also James Blake, and he was a Baptist minister. Her education, she was encouraged by her family members, her parents, to become a nurse, which she followed. And she graduated from Michael Reese Hospital School of Nursing in Chicago, Illinois in 1928, and she graduated with a nursing diploma degree. Then she went on to Teachers College at Columbia University with a Bachelor's of Science in 1936. And she did that because she wanted to teach nursing. She then went on to University of Michigan, and she got her Master's of Science in 1941. Her work history, she went to Sarah Morris Children's Hospital of Michael Reese, and she was a supervisor there, and that was after she got her nursing diploma. She went there in 1928. Then she went on to Union Medical College in Peeping, China, and she was a teacher. She taught nursing for 3 years there, pediatric nursing, and then when she was there, she had thoughts of doing advanced clinical nursing and practice and education for pediatric nursing, so she came back to the United States. She then went to the University of Michigan, and she was a teacher there. And she was also a teacher at Yale University. And she was at the University of Chicago from 1946 to 1959. She established and directed the Advanced Nursing Care for Children. Chicago terminated the nursing program in 1959, so then she left there and went to the University of Wisconsin-Madison School of Nursing. She was a professor and director at the University of Wisconsin-Madison School of Nursing for their graduate program. She also, the contributions she made to nursing healthcare, she was an author. She wrote The Child, His Parents, and the Nurse. It included an understanding of the relationship between parents and children, and it gave nurses a better understanding of involving the parents in the care of the children and treat the patients in more of an effective manner. She then co-authored editions of Essentials Pediatric Nursing and Nursing Care of the Children. Which those are two books that are used commonly in nursing school throughout the United States. She also did advanced clinical education and nursing practice, and she thought of the idea while teaching in Peiping, China. She was frequently consulted by national organizations concerning childcare, and she's awarded Professor Emeritus. And that was from the University of Wisconsin-Madison. In 1996, she was inducted to the American Nurses Association Hall of Fame. The leadership qualities she has, She's an advocate for advanced training for nurses. She has devotion to caring for children. She improved patient care. She prevented failure to thrive by helping nurses understand that caring for the caregivers is just as important as caring for the child. She allowed the child to be room in with the mother, which prevents failure to thrive. She also taught nurses not to drill the caregivers with questions due to family members can become defensive and not give adequate information. She stated that the nurse should listen to the caregivers and ask the caregivers about the day-to-day with their care with the child. It'll give the nurse more insight on how the child is cared for and the relationship between the child and the caregiver. The nurses then will be able to know more information by listening to the caregiver's explanation to the day-to-day routine. She also improved patient education within the pediatrics. She retired in 1970 in the University of Madison, Wisconsin, and she spent her last years in Madison, Wisconsin. She died on September 12, 1983. Contributions to core student learning outcomes. She synthesized leadership and management principles and concepts to support a holistic approach toward maximizing positive health outcomes. I thought she employed effective communication and leadership experiences, and she was discussing teaching learning processes in the delivery of healthcare. Contributions to professional nursing practice. I thought Florence Guinness Blake contributed to nursing practice by being a patient advocate, providing patient education, continuing education for nurses, adequate communication involving family, providing a holistic approach for the child, and she maintained professionalism. And those are my references.